The topic of this lecture is self-disorders in schizophrenia. It is a relatively new topic in clinical work in schizophrenia as well in research literature. And I will try to explain the notion of self-disorders and say something about the background for our own interest in self-disorders in schizophrenia, and also make some historical references. And finally, I will say something about the empirical situation at the current moment. The notion of self-disorders obviously refers to the notion of self. And the notion of self is perhaps familiar to most people. It overlaps very much the notion of ego. And all people are familiar with the fact that their own experience is characterized by two features, namely a sense of subjectivity, that they have their own experience, which is in many senses private experience, and a sense of individuality, that they feel themselves to be a unique individual, different from all other individuals. So the notion of self is something which sort of circulates about those two senses of subjectivity and individuality. In the philosophical literature, the notion of self was addressed by Kant, a German idealist philosopher, who said that any of our experiences is accompanied by a feeling of I think. That is, if I perceive, I know it is me who is perceiving. If I think something, I know that it is me who is thinking that. But in Kant's presentation, this prefix, I think, was a sort of unconscious, transcendental condition for experience. Another approach to the issue of self is taken by phenomenology, which agrees, of course, with Kant on the issue that all our experiences are given in first-person perspective. However, phenomenology disagrees with the claim that this sense of subjectivity is something unconscious. To understand what selfhood is and what individuality is perhaps easier to address it from the point of view of identity, because identity and self are very closely connected. Our basic identity is our basic self. So if you stop somebody on the street and ask him a question, who are you? This person would typically answer you in the following way. Well, I am John Smith. I am 30 years old. I am a married man and have 2 children. I work as a carpenter, and so forth and so forth. And he may continue to list some of his cognitive characteristics, temperamental characteristics, characterological characteristics, his IQ, his abilities, his wealth or poverty or whatever. So here, this man describes to us his identity on what we call a narrative level. It is a level of identity expressed in features which are accessible to the person in question, Many of those features, such as that he's temperamental, for example, may also be accessible to other people from outside, from a third person perspective. What John Smith will not tell us as a response to the question of his identity, he would not tell us that he's experiencing the world in the first person perspective, because his normal and tacit way of experiencing everything, it is never an object of his focal attention and reflection. It comes of itself and is never a problem. All his experiences are his own experiences. When he is perceiving something, he is pre-reflectively aware of the fact that it is him who is perceiving and not someone else. But this knowledge that it is him who is perceiving is not a self-reflection on oneself, but it is given along the perception as a pre-reflective self-intimacy. So we have this issue of first-person perspective, which is a notion referring to the fact that all our experiences are subjective. All our experiences articulate themselves in a way that they are given to us. They are mine experiences. And this articulation in the first person perspective involves also a sense, again, a pre-reflective sense, a sense which comes tacitly without any attention or introspection, a sense of self-presence, that I do exist here and now as a living individual, but it is not an object of reflection. So this is the very basic identity and very basic self of which John Smith would not talk about when he is asked about his identity. And it is this kind of self which is disturbed in schizophrenia. Whereas the self which is much more sophisticated on the narrative level, the kind of self which John Smith presented for us by his self-description, is a sophisticated entity. It is something we call personality. It is something which is evolved over time in interaction with other people. It is very heavily dependent on language, on concepts. It is normally available to introspection. And one could say that the very basic identity, the very core self of which I spoke before, that is minimal self or first-person perspective and self-presence, are prerequisites for developing a narrative self, a personality, so to say. So to put it very squarely, we see in the schizophrenia spectrum the disturbances of the very basic self, whereas in personality disorders, we see disorders of personality or narrative self. And this very basic self, comprising first-person perspective and self-presence, may be enlarged to include some other more sort of thick characteristics, such as self-demarcation, that I have a sense of privacy, of embodiment, that under normal circumstances, there is a sort of union between my psychological life and my body. And there is, of course, a sense of temporal persistency. When I wake up in the morning, I am the same person as I was yesterday. And this is a kind of persistency which sort of guarantees our sense of identity over time. So all these features of core self and this additional feature of demarcation, embodiment, and so forth, these features are disturbed in the schizophrenia spectrum. And how it was discovered in the contemporary psychiatry. We started to study patients admitted for the first time for a schizophrenia spectrum disorder. And at the time, we were very interested in the notion of common sense, on the disorder of common sense. And the disorder of common sense is an affliction in schizophrenia consisting of the fact that this sort of elementary attunement or elementary harmony between the individual and the surrounding world and social world is disturbed in the sense that situations and meanings which are normally automatically meaningful become a problem for the patient. The patient may reflect upon issues which other people take absolutely for granted, such as why there is a red light on a stoplight at a road crossing, or why is the grass green, or something like that. We were working on this topic at that time, and one of the questions which arose at that moment was, well, those patients have these problems with common sense, but the question was, how is it like to be a person, a self, having such problems? So we started to ask patients about their self-experience, and basically many young patients, or majority of young patients, complained that their fundamental problem was not so much voices or feelings of being persecuted, but rather a sense of not being really alive, of not being really present, of feelings of being cut off from the world, of lack of common sense, of a tendency to hyper-reflectivity, that they had to think about the situation which have happened during the day, or they had to reflectively anticipate situations that may come to happen. Many of those patients reported that they also felt different since they were very small children. It is a phenomenon which is in German psychiatry called Andersein, where the patient feels different from others. But what is characteristic about this feeling of difference is not so much that the patient feels different on some specific feature, like that he feels more stupid than others, or that his parents are more poor than other parents, but rather it is a feeling of difference which has no content. It is a feeling of difference which precedes finding out what is different. Because, of course, with time, the patient sort of fills out this content with some stories from the kindergarten or school, that he was mobbed or didn't really communicate with others. But what they report basically, that they feel different in their way of being a subject in the world. All these patients had many of that type of complaints, which were also linked to the experience of cognition, like having thoughts on a distance, observing one's thoughts rather than inhabiting those thoughts, having experiences with the body, which feels more as an object rather than a part of the patient's subjectivity. So we published the first paper by the 1990s on this issue, and almost simultaneously, 3 years later, Møller and Husby in Norway published a paper which was nearly identical and which was a completely independent work. So that stimulated us to go back to the literature and see whether such disturbances have been described before or whether we were really true discoverers. And in fact, of course, they were described before. So if it was anything, it was a rediscovery of self-disorders. So you can find them already in Bleuler, who considers self-disorders, what he calls experiential ego disorders, as a complex fundamental symptom of schizophrenia, that is a diagnostic symptom of schizophrenia. And there is a whole tradition in German psychiatry from the beginning of the 20th century of research into Ich-Störung, and to take the known example, Kurt Schneider with his so-called first-rank symptoms, emphasized that many of his first-rank symptoms were only diagnostic of schizophrenia on the condition of concomitantly present self-disorders, such as, for example, problems of demarcation, so the patient could experience influence phenomena or passivity phenomena or thought insertion and that kind of symptoms. So at the present moment, there is a considerable literature coming from Denmark, which you can see on the PowerPoint, coming from Denmark, coming from Norway, coming from Italy, coming from Australia, coming from Israel. This literature in sum shows that self-disorders as measured by a scale designed to detect and register those phenomena, that self-disorders hyper-aggregate selectively in patients with schizophrenia and schizotypal disorder, but not in patients with bipolar illness or patients with other psychiatric disorders. Moreover, there are now 3 studies which show that self-disorders are remarkably stable over time. There are 2 studies measuring self-disorders with a 5 years interval, and 1 study, I think, using 7 years interval. And these studies show a rather high correlation between levels of self-disorders at first assessment and second assessment. So what we can conclude at the present moment, that self-disorders reflect a change in the very infrastructure of the patient consciousness, and that this change in terms of instability of the core self is something which must be considered as a trait phenomenon, although the notion of trait phenomenon is usually reserved for observable features, such as, for instance, ears, which go like that. So these are subjective trait phenomena because they are never far away in the patient's inner psychology, so to say.